Welcome to Get the Facts, the program that provides you with information on government's policies and initiatives. I'm Beatrice Campbell. Our focus today is health, safe sex, HIV self-test strategy, and general information on the services of the National Family Planning Board. My guest is Director of Health, Promotion and Prevention, Andrea Campbell. Ms. Campbell, welcome to the program.
Thank you for having me.
All right, so the function of the National Family Planning Board has changed somewhat. You've gone into new areas. Yes. No? Please remind us of your core function.
Okay, so our core function is that we are the agency who is responsible for providing sexual and reproductive health information and service to the larger population.
Okay.
So that's our core function.
Right. And training and...
Yes, and training and media campaigns and so on. However, since 2014, we have integrated the prevention arm of the HIV program as well as the enabling environment components.
Right.
So those two components of the HIV program are now placed at the National Family Planning Board.
Right, so we're going to be talking about that strategy now, but tell me a little bit about family planning. How successful has that been? Because you're not focusing on that so much these days.
Well, we're still focusing on it, yes. So over the years, we have made some improvement. The rate now has reduced to 61. Our fertility rate is now 61 per 1,000 for Jamaica.
What does that mean?
And which means that previously it was 72, which was very high.
Yes.
And therefore we have now, so we do recognize now that persons are having less children.
Yes. All right, talk to me now about the self-test, the HIV self-test strategy.
Okay, so HIV self-testing strategy it's a strategy that we have implemented since 2020. We did a pilot and we recognized the pilot was very successful. Persons were interested to use the HIV self-testing. So it offers another option for persons to know their HIV status, as well as it will help us to achieve our UNAIDS goal of 90-90-90. Right. That's getting 90% of persons who are infected will know their HIV status. 90% of those who know their status will be on medication and hence lead to viral suppression. So 90% of the persons who are on medication should be virally suppressed, and that's the UNAIDS goal. And therefore, offering self-testing is actually another option of trying to achieve our first 90.
Yes.
And as at 2020, we were actually at 86 of the first 90. So we're getting there.
Because you were offering the test before you actually did it yourself.
Yes, we offered the Aura Quick before, but it was actually done by the outreach officers who did the test, right? However, now we're actually giving persons the test to say, okay, go home and do your test.
So you're not giving out the kits, as we would call them?
Yes.
You're not giving
so
that
persons will be able to access a kit.
Yes.
Well, they are able to access it now at selected pharmacies. We have 20...
For free?
No.
Okay.
27 pharmacies that they can purchase the kits presently across the island. However, come next month, early March, we will be rolling out the HIV self-testing strategy across the public sector, where persons can access a kit, whether through their health facility or from the community workers attached to the program, or any of the 4 CSOs that provide HIV services.
All right, so this self-testing, is it easy? I mean, you're asking persons to do it. Does it involve a needle?
No needle, no needle at all. It's actually just a swab of the gum line, and they are able, so the instructions are with the package, and also when persons access the kit from the outreach worker, or whoever they access it from, they should get the information, and they'll also get a leaflet as to the instructions of how to use the kit. So it's just swabbing the gum line to collect
the matter.
Yes, and then they'll just test. It's simple, 1, 2, 3. And within 15 to 20 minutes, they will know their status.
Excellent. So a kit can only be used once?
Once, yes.
Okay.
Yes.
So you said there are 27 pharmacies where we can get these kits now?
Yes.
Right, but across the island?
Yeah, across the
very
island.
Good, very
right.
good, very
yes.
good. What's the cost?
Well, the cost varies. It's between 1,200 and 2,000 per kit.
Okay.
Yeah.
And that's a cost. Can you use health cards to get the kit?
It depends on the pharmacy.
Okay.
Yes,
Okay.
yes.
So we want to achieve this 95. Well, you said 90%.
90% by 90% by 2025. That's our aim now.
What figures look like now? What do they look like now?
It's pretty good. As I said, we are at 86%. So that's about 28,000 persons who actually know their status.
People are actually actually coming out now to get their kits and are using
Persons
it. Yes.
have been asking. As I said, we did the pilot in 2020,
Yes.
and we had 595 persons who actually took a kit, and of the 599, 499 used it. When we followed up, reported that they used it. And for those who didn't use it, it was just various reasons. Persons were scared of getting the result. Persons were a bit anxious of doing the test.
Yes.
But overall, the overall response was very good. And in last year, April, we launched our public-private partnership with the pharmacies, and we supplied 22 pharmacies with kits, between 5 and 10 kits.
Yes, yes.
And when we did a follow-up 3 months later, all of them were sold out.
Excellent.
And since then, we have expanded so we have now 27 pharmacies on board, and all of them have stocks, and some persons have actually reordered stocks since then.
You said that you follow up with the people who you give the kits to, right?
Okay, yes.
But what about those for the pilot?
For the pilot.
How do you measure that now? How do you know the status of the persons who would have bought their kits at the pharmacies?
Well, we don't know the status. That is one thing. We don't know the status. But we are hoping that if with persons' personal responsibility and persons, when knowing their status, because they know where they can go to access treatment, then they would be accessing treatment.
And then you probably could use that information.
Yes. So we will be collecting, for persons who come into the treatment sites, we will be collecting information as to, did you do a HIV self-test? Yes. So hopefully the next 2 years we should be able to say, X amount of persons came in because they used the self-test.
Right. But is there any kind of plan to reach these people, any kind of link with the pharmacies?
Well, data, demographics, the only thing is collected from the pharmacies would be their age range and whether it's male or female, and as I said, they get a leaflet that they can call in.
Yes.
So we're hoping that persons will call and persons will access treatment, whether from their private doctors or through any of the treatment sites available across the island.
I can see you'll have some issue with this new Data Protection Act, but that's another program.
Yes, it is.
We're talking health issues today, and we take a break now and return after this message. So stay with us. Welcome back to Get the Facts. Our discussion continues with the Director of Health Promotion and Prevention at the National Family Planning Board, Andrea Campbell. Now, the agency is also focused on safe sex and the use of contraceptives. Let's talk about that. How is that going? And some of the initiatives that you have?
Okay, so we have continued our program for the distribution of contraceptives. We are now focusing a lot on our young persons and what we call multiparous women, persons with more than 3 or more children. So therefore, at the National Family Planning Board, persons are able to access contraceptives, the pills or the injections. They can come in. We have a nurse on site that they are able to access their contraceptives. We are also the agency who with responsibility for the procurement and distribution of contraceptives island-wide. Mm-hmm. So therefore, we supply all the regional health authorities with contraceptives. So persons should be able to access contraceptives from any of their health centers free of cost.
How do you define safer sex?
Safer sex. Safer sex is actually not just contraceptive, but using another method. So it's using a condom with whatever contraceptives you're using, unless you're using the condom as the contraceptive. We are promoting safer sex because we do recognize that HIV is still around, and therefore using a contraceptive, a pill or an injection or the implant doesn't prevent you from getting HIV. This year we are making a special effort to reach our adolescent and young persons, because from the data coming out of the HIV program last year, 16% of new HIV cases were among the young people, that's up to 24 age group. So therefore, we are making special effort to reach our adolescent and young persons this year with safer sex messages.
But HIV is not the only STI that you're concerned with.
Right. Mm-hmm. So therefore, syphilis, we do testing for syphilis as well. And there has been an increase in cases of syphilis.
There's an increase.
So, yes. So therefore, we encourage persons to get their checks and use a condom every time, whatever method you are on.
How does one know if he or she has syphilis?
Well, there are certain signs and symptoms of syphilis. Yes. The first sign would be a sore in your genital area, and therefore, so we would encourage persons, any sign of any sore, then you should get it checked out.
Yes, and there's syphilis can be cured?
Yes, syphilis can be cured. However, the longer you have it, the more serious it gets, and the longer it takes to be treated as well. And there will come a time when the treatment wouldn't be as effective as if you get treated as soon as you recognize that you have it. Right. So you can get tested, just like how we have the rapid test for HIV, there's a rapid test for syphilis as well. So when we do a HIV test, we usually just do a syphilis test as well. Yes.
And there's still gonorrhea.
Gonorrhea is still around, yes, all of them. Herpes. Still around, chlamydia, yeast infections. So hence, we are promoting safer sex. Whatever method you're on, use a condom as well. Yes, so it's dual protection.
Yes. So what's the relation between safe sex and a healthy population?
Okay, so safe sex promotes a reduction in STIs as well as the unwanted pregnancy. So if you, with less unwanted pregnancy and less STI, then we are hoping that we'll have a more productive environment. Persons won't have to be taking time off for maternity leave and taking time off to go to the clinics and so on if they have an STI. So we hope that production will increase, our workforce will be increased as well, which should lead to a better quality of life.
Yes. How do you engage people now?
Well, we have several media campaigns, and we have outreach workers as well out there spreading the messages. We have regular trainings with our healthcare providers for contraceptives. We have introduced the implant for persons, and so therefore now it's not just the pill and injection, but we have the implant that lasts for between 3 to 5 years.
Talk to us about the implant.
Okay, so Presently, what we have is the lever plant, and the lever plant is an implant that goes under the skin, just right under the skin, and it's a hormonal method that releases hormone into your body for a period of 3 years. So it prevents pregnancy for 3 years. After 3 years, you remove it and you become fertile immediately. So at least you'll be preventing pregnancy for another 3 years.
Okay.
Yes,
All right.
and that's a new. We have trained persons. We had some support from IDB for a program to insert another implant called Jadel in adolescents, and our target was to reach 500 adolescents. We actually reinserted implant in 540 adolescents.
Okay.
Yes.
Okay, tell me about the activities for Safer Sex Week.
Okay, so Safer Sex Week, we'll be targeting our young persons, or adolescent and young persons up to 24 years old. The theme this year is Do Your Part, Safer Sex is a Start. We'll be having several IG Live. I'm sure that you've heard of the Marge Roper Counseling Service.
Definitely.
Right, from two is better than too many days. So we have rebranded the youth arm of the Marge Roper Counseling Services to target our young persons, and it's now called Youth Expression. So during Safer Sex Week, we will be having the launch of our Youth Expression program, as well as targeting our adolescents with some IG Lives, using some influencers to get the message across to our young persons.
Remind us of the theme again.
Do your part, Safer Sex is a start.
Okay, what's your part?
Do your part.
What's the part?
Use a condom.
Use a condom.
Practice safe sex.
Yes.
Yes, or abstain.
Yes.
Because the message is we still have young persons out there who we would like to abstain, So do your part. Safer sex is a start. And abstinence is also a part of safer sex.
Right. Thank you so very much for coming to share with us today. It was a real and important conversation. This has been Get the Facts. Our guest was Director of Health Promotion and Prevention at the National Family Planning Board, Andrea Campbell. Thank you so very much for watching. Until next time, I'm Andrea Campbell. Take good care.